got spinal stenosis, these are some of my favorite exercises to do. I'm going to be breaking them down into mobility, stretches, and core stability exercises. So make sure you watch right until the very end. Hello everyone, my name is Joy Agude. I'm a chartered physiotherapist and the proud founder of The London Physio. So we are a virtual physiotherapy service that you can tap into from anywhere in the country. Sometimes we can also do home visits and clinic sessions as well. If you need some one-to-one help with your spinal stenosis, make sure you get in touch. It's all the w's.thelondonphysio.co.uk and simply click book now to book your appointment. As usual, little disclaimer, this is general advice. As with all of our posts on social media, do not use this to replace any diagnosis or medical advice that you have been given. If you haven't already, then please click the subscribe button and give this video a thumbs up. It helps other people who need the value in this video find us easily so that they can benefit from it just like you are. Also, remember you could click the notifications button so that every time I post a video, you would be the first to see it. Now, without further ado, let's get into the video. So here are a few things that you should expect to learn from this video. Number one, I'm going to tell you a little bit about the anatomy of the spine. I'm going to tell you about the spinal cord and what spinal stenosis actually is. Then I'm going to briefly talk about some symptoms of spinal stenosis and how to expect where the symptoms happen, or if you have certain symptoms, then you have an idea where it might be happening in the spine. Finally, I'm going to go into the exercises, but as I said at the beginning of the video, I'm going to break them down into three parts. One would be mobility, another one would be stretches, and then another one would be strengthening. These are three things that your spine needs in order to optimize its function. So make sure you watch till the very end. Let's go. In your spine, it's a whole column all the way down from your neck, all the way down to your tailbone. And in very simple terms, you have bones. We call them vertebrae. So each bone represents a level in the spine. You've probably heard people say things like C1, C2, C3. Every bone has a number, T1 all the way to T12. Thoracic, right? C means cervical. And then L1 to L5, that's lumbar, meaning your lower back. So neck, thoracic, lumbar, then you have sacral and all of that. But you essentially have vertebral bodies. Let's call them bodies. They're just bones, right? They sort of stand on each other, but they're separated by discs. So the spinal cord runs through a hole that all of these bones have made collectively called the spinal canal. Now that spinal canal also protects the spinal cord because you can imagine it's very sensitive. It's literally the reason why your body functions the way it does. Imagine your spinal canal running down and then on one level, something's pushing onto it. So it's now taking up a little bit of space and pushing onto the spinal cord. That is called spinal stenosis. The reason for that is because it has caused a narrowing of the spinal canal. And now depending on the amount of narrowing, it could be pushing onto the spinal cord or it could be pushing onto a branch of the spinal cord. It literally could be affecting the nerves in some way. But in general, that is what we call spinal stenosis. It is the narrowing of the spinal canal. Now, the nerves do not like anything pushing on them. They like to just be free. If anything is pushing on your nerves, they send symptoms such as pins and needles, numbness. So if you're feeling numbness in your feet, for example, or pins and needles in your feet, it is possible that if you had spinal stenosis, your nerves were being irritated on some level in the spinal canal. It may not necessarily be being irritated in your feet because that nerve is originating from the spinal canal and coming all the way down to your feet. So yes, it could be irritated anywhere along the length of the nerve. If you have spinal stenosis, yours is being irritated somewhere in the spinal canal. This is why it's very important to not watch videos to get your diagnosis. Make sure you get your diagnosis one-on-one with a physio. You may have the same symptoms, but you may not necessarily have spinal stenosis. So essentially, the intensity of your symptoms and the location of your symptoms will depend on how much narrowing stretching there is in the column, but also what level of the column is being narrowed and whether the nerves are being impinged or not. Some people may just get back pain, some people might get pain and then nerve pain. So it just depends on a whole host of things. Now, this is one place that a lot of patients get trapped. Generally, your back likes movement, whether it's spinal stenosis, whether it's sciatica, whether it's general back pain, your back actually enjoys movement. However, the wrong movement, depending on your diagnosis, can make the pain worse. So certainly when it comes to spinal stenosis, extension is something that you don't want to be doing. That will apply to everything. If you're someone who sleeps on your front with a pillow under your head and you're like extended, you're not gonna like that. For spinal stenosis, you want to encourage flexion to relieve the amount of pressure. So the next part of the video is me breaking down what those movements would be. So make sure you stay till the very end. The first 3 exercises are mobility, which means that you don't have to hold at the end. Mobility just means you can repeat the exercises in terms of reps. So I'd recommend about 10 to 15 repetitions of each exercise, depending on your pain. And you can repeat this 2, 3, 4, 5 times a day if you like. 3 is generally all right. Exercise number 1 is lumbar spine rotation. You just want the top half of your body to be flat against the floor, and then you want your knees bent, knees together, feet together, and you're going to rotate from side to side. Now the key is to have your arms out. Make sure that the opposite shoulder doesn't come along when, for example, if your knees are going all the way to the right, make sure that your left shoulder doesn't come along. Otherwise, you're not going to get that rotation in the spine. The further your feet come back close to your bottom, the more range of movement you are going to get in your lumbar spine. But if you are in a lot of pain, just bend to what feels comfortable for you. Exercise number 2 is knee hugs. You can literally just hug the knee to your chest and then let go of the leg. Pull the other knee to your chest, let go of the leg, or you hug both knees to your chest and then let go of your leg. The closer you hug the knees to your chest, the more of a stretch you get in your lower back. And if you want, you could bring your head up as well to get a nice deep stretch all the way through your back. But if you're in a lot of pain, for example, then just feel free to leave your head down so you don't need to hold. However, if you wanted to do it as a stretch, if you felt really good in that position, you can hold for up to 30 seconds if you want. But for the purpose of this video, I'm giving it to you as a range of movement exercise. Mobility exercise number 3 is a sit to stand. So just make sure your pelvis is tilted backwards when you sit, and then you go into a standing position. Do this one with caution, I would say. Just make sure you don't hyperextend right at the top. That's going to cause your pain to get worse. Also, feel free to only go as high as you feel comfortable. And if it does feel comfortable, then you can increase the pace or maybe even slow it down if it doesn't, or totally stop the exercise altogether. Next up, these 3 exercises are stretches, and because they are stretches, I need you to hold them at the end of range. The mind to muscle connection, where am I feeling the stretch? Does it feel good? How long can I hold for before it becomes really uncomfortable? Is the discomfort feeling like a nice release, or is it feeling like pain? I want you to hold the stretch for 30 seconds or up to 30 seconds. So if 10 is comfortable for you, that's fine. If 15 is comfortable for you, that's fine. If 30 is comfortable, that's even better. But do not repeat any of these stretches more than 3 times for each set. The first one we're going to look at is a piriformis stretch. For this exercise, we're going to be laying down on the floor. Your back is flat. The foot that you're stretching is on the opposite knee. Then you're going to pull the knee that's not being stretched, and you're going to push the knee that's being stretched. I want you to hold this position. So you're doing 2 things here. You're pulling and you're pushing. If you find that difficult or you don't have a lot of strength in your arms, you can do this exercise against a wall. So essentially the wall is pushing you up and then you are just focusing on pushing down. Also, you can do it sitting where the floor is stopping you, of course, and then you are pushing down on that leg, but you can also lean forwards to add pressure to the push. You should feel it in your bum essentially of the side that you are stretching. Stretch number 2 is a hamstring stretch. We're going to stay lying down, bend the knee that you are not stretching. Instead of you extending the lumbar spine because the weight of that leg is going to be pulling on your spine, keep it bent. That way you have a little bit of support in the lumbar spine into that flexion position that we know that your spinal stenosis likes. So for the leg that you're about to stretch, I want you to have the knee of that leg above the hip and then keep it in a bent position. Put your towel or your bag, anything that doesn't stretch, okay? So put it around your foot, and then from this position, I want you to straighten your knee. The reason why we've done it this way is because we don't want to pull on that sciatic nerve, just in case your sciatic nerve has some issues, in which case there are other exercises for that. The last thing you want to do is to pull on the sciatic nerve to further irritate it. You start in that bent knee position, knee above the hip, and then you extend the leg and you hold for 30 seconds or up to 30 seconds and repeat 3 times. Stretch number 3 is child's pose. What I like to do is open up my knees so that way I have enough space to bend forwards. Make sure that you sit your bum back onto your heels as well. That's really going to help with the opening of the lumbar spine. So you're sitting your bum back and then you're also reaching your arms forwards. That's really going to help you open up the lumbar spine even more. Now, if you've got knee problems, you can sit down in a chair and you can just bend forwards to touch the floor. The further down you go, the more of a bend or flexion you will get in your lower back, as in your lumbar spine. And as with all the other stretches, I want you to hold the stretch for 30 seconds or up to 30 seconds, but do not repeat any of these stretches more than 3 times for each set. Now let's move on to strengthening. Now remember what I said before, your spine enjoys movement. Movement is fantastic for the spine. The stretches will get you there. The mobility will get you there. But what your spine also really loves is strength. It needs to be strong. And I'm not talking like bulky strong. I'm talking core stability. I'm talking the kind of strength that if someone had it, you may not even know just by looking at them. If you think about strong men, they don't look like they've got the 6-pack and all of that because we're not dealing with those muscles. They have that core stability, that transversus abdominis stability, okay? This is a muscle that wraps around you literally like a corset. It wraps around your spine. It's deep to your spine. These are the muscles that we want to train when it comes to strengthening. So here are 3 amazing exercises to help you strengthen your transversus abdominis muscle. Exercise number 1 is a very simple pelvic tilt. You have to master this one correctly. The reason being, this is literally how you make this muscle work. It's how you wake it up. It's how you engage the muscle. So for the purpose of this exercise, you're going to be laying down. In this position, I want you to use your index fingers on both sides to find your pelvic bone. If you put your hands exactly where I'm putting my hands, just by looking at the video, okay? Or just on your waist if you like, you're gonna be able to feel protruding bones, and it's just your pelvis. Now I want you to just go inside a little bit. That's where your transversus abdominis is, but right now it's chilling. It's doing absolutely nothing. When you actually get this muscle to work, you're going to feel a push under your index fingers. It's gonna be subtle if you haven't trained in a while, but if you're used to it, then you're just gonna feel a big push. What I want you to do is actually just tilt your pelvis backwards, so almost kind of flatten the small of your back against the floor and feel that muscle just come to the surface. Once the muscle's been activated, I want you to hold this. 5 to 10 seconds is absolutely fine, and then relax. Then I want you to do it again and repeat that exercise 10 times. Exercise number 2. This exercise is called a dead bug. In this position, you're going to go into tabletop, meaning your knees are going to be bent and your feet are going to be off the floor. You're going to flatten your back, engage the transversus abdominis, which you now know how to engage. And then I want you to straighten one leg, keeping your back flat, making sure it doesn't peel off the floor. And the lower down you go, the more your back is going to want to peel off the floor. So I want you to to just stop wherever it comes off. And if you're strong enough, go all the way down, but hover. Don't touch the floor and then come back up. If you find that hard, just tap the floor and come back up. That's totally fine. If you're really good at this exercise, you can do opposite arm, opposite leg at the same time. Or you can just do one arm, or you can just do one leg. Whichever one you choose to do, hold for 5 or 10 seconds, then repeat it. 10 reps. Exercise number 3 is called the bird dog. You're in a prone position, meaning you are now against gravity. So before, gravity was helping you. Now you're having to engage the transversus abdominis against gravity, which makes it super hard. And it also makes it hard for you to know if the muscle is working. So you have to sort of trust yourself and trust your instinct on this one. And I would say if you haven't mastered the first 2 strengthening exercises, try not to do this one yet. For this one, engage the muscle, pull your belly button up and in, hold that engagement, and then slowly take one leg out and back in. You can take one arm out and back in. You can take opposite arm, opposite leg, which is harder, and back in. So whichever your variation is, totally fine. Start there and then progress. Those are all the exercises I have for you today. Just to summarize, we've talked about spinal stenosis, a little bit about the anatomy of the spine. We've also talked about the symptoms that you would get. We've talked about the exercises that would be useful. We've broken them down into mobility, stretches, and strengthening. Remember, if you need a physiotherapist one-to-one, we are available. It's all the w's.thelondonphysio.co.uk. You can book directly into my calendar. You can book a virtual session. We can sometimes do home visits as well, and sometimes we do clinic sessions too. So wherever you are in the country, you can literally tap into us. If you want a second opinion or you want to switch physios, the way that we physio, we make it super accessible. There is no reason for you to continue to be in pain. So I hope that this video has been very useful. If you found it useful, maybe share it with a friend or somebody that you know could benefit from it. And if there are other videos that you want me to make, please definitely leave a comment below. If you've enjoyed this video, remember to give it a thumbs up. If you haven't subscribed, please remember to subscribe. And if you enjoyed watching this video, I'm pretty sure you'll enjoy these as well. Until next time, look after yourself and each other.